A dog presents with vomiting, diarrhea, and lethargy. Which diagnostic test is most critical to perform first? A. Complete blood count, CBC. B. Fecal flotation. C. Abdominal radiographs. D. Urinalysis. Answer A. CBC is essential to assess hydration status, electrolyte imbalances, and systemic infection, guiding immediate treatment. Which needle gauge is most appropriate for venipuncture in a 5 kg cat? A. 18G. B. 22G. C. 16G. D. 14G. Answer B. A 22G needle is ideal for small animals like cats to minimize vein trauma while allowing adequate blood flow. During surgery, a patient shows a sudden drop in blood pressure. What is the first action the veterinary technician should take? A. Increase anesthesia depth. B. Notify the veterinarian immediately. C. Administer oxygen only. D. Continue monitoring. Answer B. Hypotension during anesthesia is critical. Immediate communication allows rapid intervention to prevent organ damage. Which of the following is a zoonotic parasite commonly found in dogs? A. Toxoplasma gondii. B. Giardia spp. C. Ancylostoma spp. Hookworms. D. Eimeria spp. Answer C. Hookworms can infect humans through skin contact with contaminated feces, making them a zoonotic concern. A feline patient requires a subcutaneous injection. The maximum volume per site should generally not exceed A. 1 milliliter. B. 5 milliliters. C. 10 milliliters. D. 20 milliliters. Answer B. Cats tolerate 3 to 5 milliliters per subcutaneous site. Exceeding this can cause discomfort or tissue damage. Which fluid type is best for rapid dehydration correction in a dog? A. 0.9% saline. B. Lactated Ringer's solution. C. 5% dextrose in water. D. 0.45% saline. Answer B. Lactated Ringer's provides electrolytes and is isotonic, making it ideal for rehydration and fluid replacement. Which heart rate is considered tachycardia in an adult horse? A. 20 to 40 bpm. B. 28 to 44 bpm. C. Greater than 60 bpm. D. Greater than 120 bpm. Answer C. Normal equine heart rate is 28 to 44 bpm. Rates above 60 bpm indicate tachycardia and possible stress or illness. A technician notices petechiae on a dog's gums. This could indicate A. Dehydration. B. Coagulopathy. C. Hypothyroidism. D. Osteoarthritis. Answer B. Petechiae result from capillary bleeding, often linked to platelet disorders or coagulation defects. When restraining a rabbit for venipuncture, which vein is most commonly used? A. Cephalic vein. B. Jugular vein. C. Lateral saphenous vein. D. Marginal ear vein. Answer D. The marginal ear vein allows access with minimal stress and is commonly used for small blood collections in rabbits. What is the normal respiratory rate for a resting adult dog? A. 10 to 20 breaths/min. B. 18 to 34 breaths/min. C. 60 to 100 breaths/min. D. 40 to 60 breaths/min. Answer B. Adult dogs at rest typically have a respiratory rate of 18 to 34 breaths per minute. Deviations can indicate respiratory compromise. A feline patient is diagnosed with hyperthyroidism. Which medication is most commonly prescribed? A. Methimazole. B. Levothyroxine. C. Prednisone. D. Furosemide. Answer A. Methimazole inhibits thyroid hormone production and is the standard first-line treatment for hyperthyroid cats. Which PPE is essential when handling chemotherapeutic agents? A. Gloves and goggles. B. Standard lab coat. C. Surgical mask only. D. Apron only. Answer A. Chemotherapy drugs are hazardous. Gloves and eye protection prevent exposure and accidental absorption. What is the most accurate method to measure a dog's core body temperature? A. Axillary thermometer. B. Rectal thermometer. C. Oral thermometer. D. Infrared forehead thermometer. Answer B. Rectal thermometers provide the most reliable core temperature readings in dogs. Which condition is a contraindication for using succinylcholine in anesthesia? A. Hypothermia. B. Hypoglycemia. C. Bradycardia. D. Hyperkalemia. Answer D. Succinylcholine can worsen hyperkalemia, potentially causing cardiac arrhythmias. A technician is asked to perform a fecal flotation. The primary purpose is to A. Measure fecal pH. B. Detect parasite eggs or cysts. C. Assess protein content. D. Determine fat concentration. Answer B. Fecal flotation separates parasite eggs from fecal debris for microscopic identification. Which anesthetic monitoring parameter is most sensitive for early hypoxia? A. Heart rate. B. Mucous membrane color. C. Respiratory rate. D. Capnography. Answer D. Capnography detects CO2 levels in exhaled air, providing early warning of hypoventilation or hypoxia. A technician notes a cat's systolic blood pressure is 150 millimeters of mercury. This is considered A. Normal. B. Hypertensive. C. Hypotensive. D. Tachycardic. Answer B. Normal feline systolic BP is 120 to 140 millimeters of mercury. 150 millimeters of mercury indicates mild hypertension, requiring monitoring. Which syringe size is most appropriate for administering 0.5 milliliters of vaccine to a cat? A. 3 milliliters. B. 1 milliliter. C. 5 milliliters. D. 10 milliliters. Answer B. A 1 milliliter syringe allows precise measurement of small volumes, reducing dosing errors. When performing an ear cleaning, the ST must avoid A. Using cotton balls to wipe the pinna. B. Instilling solution into the ear canal. C. Inserting cotton-tipped applicators deeply. D. Wearing gloves. Answer C. Deep insertion can damage the tympanic membrane. Cleaning should remain superficial unless instructed otherwise. Which of the following is a core vaccine for dogs? A. Rabies. B. Bordetella bronchoseptica. C. Leptospira. D. Lyme disease. Answer A. Rabies vaccination is mandatory and considered core due to public health risk. A technician observes a horse pawing and sweating. This may indicate A. Colic. B. Hypothyroidism. C. Arthritis. D. Laminitis. Answer A. Pawing, rolling, and sweating are early signs of colic, a potentially life-threatening condition in horses. During forecatheter placement, the ST notices resistance when advancing the catheter. The best next step is A. Force it through. B. Withdraw slightly and reposition. C. Continue without concern. D. Use a larger catheter. Answer B. Resistance may indicate vein damage or incorrect angle. Withdrawing and repositioning reduces the risk of injury. Which fluid should be avoided in hypovolemic shock with severe acidosis? A. Lactated ringers. B. 0.9% saline. C. Dextrose 5% in water. D. Colloid solution. Answer C. Dextrose-only solutions do not correct electrolyte deficits and can worsen acidosis. Isotonic crystalloids are preferred. The technician notices a dog's mucous membranes are pale. This could indicate A. Shock or anemia. B. Hyperthyroidism. C. Dehydration. D. Pain. Answer A. Pale gums suggest decreased perfusion or low RBC count, requiring immediate veterinary assessment. When restraining a fractious cat, the safest method is A. Scruffing alone. B. Use of a towel or cat bag. C. Holding by the tail. D. Placing directly on the table. Answer B. Towels or cat bags minimize stress and prevent injury to both the cat and staff. Which lab value indicates renal dysfunction in a dog? A. Elevated ALT. B. Elevated BUN and creatinine. C. Low glucose. D. High bilirubin. Answer B. BUN and creatinine are primary indicators of kidney function. Elevated levels suggest renal impairment. Which patient positioning is ideal for abdominal ultrasonography in a dog? A. Dorsal recumbency. B. Lateral recumbency. C. Standing. D. Sternal recumbency. Answer A. Dorsal recumbency provides the best access to abdominal organs and allows optimal probe placement. A technician is asked to perform a skin scrape. The purpose is to A. Detect internal parasites. B. Diagnose external parasites like mites. C. Measure skin pH. D. Collect DNA for genetics. Answer B. Skin scrapings are used to identify ectoparasites such as mites or mange-causing organisms. Which of the following is a sign of hypoglycemia in a small animal? A. Seizures and weakness. B. Vomiting. C. Increased appetite. D. Polyuria. Answer A. Hypoglycemia can cause neurological symptoms such as seizures, tremors, and weakness. When handling chemotherapeutic waste, the ST should A. Dispose in regular trash. B. Use designated hazardous waste containers. C. Pour down the drain. D. Dilute and discard. Answer B. Chemotherapy waste is toxic. It must be handled according to facility protocols to prevent contamination or exposure.